Hi, everyone. As you come in, folks get on the line. All participants will be muted today until the public comment portion when it is your time to speak. If you're the first 30 registered, um, this meeting is being recorded. We will have links to drop in the chat if you'd like to submit a written comment or things of that nature. If there's still time at the end, feel free to comment to us to say that you would like to speak and use the chat functions below. If you have any other questions, please view this slide and I will pass it to our State Board of Health representative, Dr. Karen Phelan.
Thank you, Samantha. Thank you all for joining us today for the Healthy Illinois 2028 SHIP, State Health Improvement Plan, public hearings. Again, I'm Karen Phelan, and I'm the chair of the Illinois State Board of Health. On behalf of the State Board of Health members listed on the screen, we are excited to share the draft Healthy Illinois 2028 State Health Assessment, SHAW, and State Health Improvement Plan, and hear your feedback. Our objectives today will be to share a brief summary of the State Health Assessment process and findings and the State Health Improvement Plan draft, to hear from members of the public with your feedback and comments, and to share next steps. The State Health Assessment included 4 assessment processes, and this data informed the selected priorities defined in the State Health Assessment Report. This State Health Improvement Plan includes a plan to address the priorities collectively. Together, these documents will be referred to as Healthy Illinois 2028. Our agenda and process for today is explained on this slide. All participants will remain muted until we call those to provide public comments on the SHIP. Only the first 30 members of the public who have registered will be called to present for up to 3 minutes each. Written comments may be provided also at the link provided. Please note once again that this meeting is being recorded for public viewing on the IDPH website. If you experience any technical difficulties, please message Samantha at samantha.lasky@iphionline.org. Thank you. And now I will pass it over to Dr. Samir Vora, the director of the Illinois Department of Public Health.
Well, thank you so much, Chair Phelan, for your leadership and the leadership of all of our members of the State Board of Health. As Chair Phelan mentioned, I'm Samir Vora. I'm the director of the Illinois Department of Public Health, and I'm so excited to be here with all of you today on day 2 as we share the data and findings and solicit your feedback on a plan that we have been working on with over 100 public health partners across Illinois, the Healthy Illinois 2028 State Health Improvement Plan. We're here today because we know how valuable all of you are to building a Healthy Illinois 2028, and we seek your input to make this State Health Improvement Plan as beneficial as possible to all members of the state. In addition to the many members of the public who provided input during our assessment process and the many partners and subject matter experts who contributed to that plan, you'll hear more about those individuals shortly. I would like to recognize and thank the staff and partners who led this process. I want to shout out especially the leadership of Jenny Epstein, our Deputy Director of the Office of Policy, Planning, and Statistics, and her staff member, April Kalk, along with the IDPH staff who are closely involved in the process, and they're listed here on the screen in front of you. I would also like to thank 2 sets of critical partners who really helped push forward the state health assessment and the state health improvement plan. First, the University of Illinois at Chicago School of Public Health and the Policy, Practice, and Prevention Resource Center, also known as P3RC, and their subcontractor, the Illinois Public Health Institute, who is facilitating today's session. Finally, I would like to recognize the State Health Assessment, State Health Improvement Plan Partnership. a partnership appointed collaboratively by the previous IDPH director, Dr. Ngozi Ezike, and Governor Pritzker for aiding in the development of the SHIP alongside IDPH and the UIC IPHI planning team. Now, this group met monthly throughout 2022, moved to quarterly meetings in 2023, and helped plan the assessment activities, reviewed the data and identified findings, selected priorities based on the data, and helped develop goals and objectives, and identified those subject matter experts to finalize the draft plan that we'll be presenting today. This partnership will continue to monitor implementation and measurement of this work. As you see on this slide, the partnership were individuals across different sectors from throughout the state, and I thank them for their leadership and commitment to health here in Illinois. So Healthy Illinois 2028, an aspiration for us across state government, but also something that is a partnership with all of you on this call, all of our partnership organizations, and all communities across the state. And the vision of Healthy Illinois 2028 is as follows. We are looking to achieve health equity across Illinois by addressing structural and social determinants of health through a unified public health system. And a unified public health system that requires community engagement and collaboration, a strong workforce, and a sustainable and flexible local funding to make us healthier as a state and achieve this Healthy Illinois 2028 vision. The partnership also knows that in order to get to a Healthy Illinois 2028, that we needed to think about fundamental principles and practices that would support the advancement of the vision and guide the development of the state health improvement goals, objectives, and strategies. As you see from the screen, there was an intentionality here to focus around core infrastructure type issues in a meaningful way that would break down silos when possible, use policy systems and environmental strategies for lasting impact, engage the community throughout the process, knowing that this is just the first step in a 5-year journey to get to Healthy Illinois 2028, and knowing that all of these principles would be incredibly important as we implement the state health improvement plan. So again, I want to thank all of you for taking time out of your busy schedules to help us push for the state health improvement plan. And I will pass it to Samantha Lasky from the Illinois Public Health Institute to provide an overview of the process for developing both the state health assessment and the state health improvement plan. Samantha?
Thank you so much, Dr. Bora. Hi, I'm Samantha Lasky, and I'm a program manager with the Illinois Public Health Institute. I was part of the team to help lead the SHOT and SHIP process. Starting in 2021 and through 2022, there were significant updates to the state health assessment, state health improvement plan law to reflect the changing public health landscape, increase focus on health equity, strengthen community engagement in the process, and to extend the timeline for completion. Here are some of the updates on this slide. This slide here shows the timeline from the 2021 SHIP update, also known as the Healthy Illinois 2021 update, through the development of the state health assessment and state health improvement plan to when we plan to launch the implementation of the SHIP on January 1st. The SHIP were updated in 2021 to launch the process. Beginning in 2020 with a team of partners established prior to the SHA-SHIP partnership, Illinois began a shortened version of the SHA-SHIP process known as the Healthy Illinois 2021 update to meet the law and prepare for a comprehensive SHA-SHIP the following year. It was not a comprehensive process initially due to how many of our partners were focused on the COVID-19 pandemic. We'll dive back into the Healthy Illinois 2021 update in a moment. This update served as the foundation for the Healthy Illinois 2028 process and documents. Beginning in 2021, the SHA-SHIP partnership was developed to further drive a comprehensive SHA and SHIP. We adapted the mobilizing action through planning and partnerships framework developed by the National Association of City and County Health Officials, also known as the MAP framework developed by NACCHO. The MAP framework was undergoing a revision process during this time, so we used an adaptation of the previous model. There are 4 assessments listed here that we conducted that include the health status assessment, the community health status assessment, which provides an understanding of the demographics, the health behaviors, health outcomes, and social determinant conditions of our state. This included an extensive data collection and analysis process from various forms of community health surveillance and data. Next, we conducted the Community Themes and Strengths Assessment, which is really a community engagement report to help us understand the perceptions of the community as it relates to assessments, as assets and issues that are important to the community. Community engagement activities included 16 initial focus groups with local health departments and social service providers, as well as people with lived experience. Following the completion of the community engagement report, we conducted an additional 5 focus groups with people with lived experience, which were a subset of the original group, to share data from that report and get feedback on the proposed priorities. Another assessment we completed was the Forces of Change assessment, which identifies forces that may affect the health of the community and/or the public health system and the threats and opportunities associated with those forces. The FOCA was completed during the partnership meetings with guest speakers that spoke to current or likely forces of change, as well as group discussions identifying opportunities and threats associated with those and other forces of change to identify themes in the public health landscape. And finally, the public health system assessment. For this assessment, we looked at the capacity and capability of the system to deliver the 10 essential public health services while centering health equity. As NACCHO was in the process of developing an updated MAP handbook, the SHA-SHIP planning team and partnership worked together to develop and adapt the assessment to develop the health equity capacity assessment. The health equity capacity assessment was conducted virtually over a half day with over 85 public health system partners. We worked with the partnership to develop findings from each of the assessments and identify themes across multiple assessments. The themes were synthesized to define the priorities emerged from the data. As previously mentioned, the Healthy Illinois 2021 update produced this update to serve as guidance until the new SHA-SHIP could take its place. The updated data for this found that access to care, chronic disease, and mental and behavioral health, which were the 3 priority issues from the previous SHIP, Healthy Illinois 2021, remained high priorities, and several new priority issues were then defined and identified for this update, which included structural racism, public health system capacity and infrastructure, health equity, and COVID-19, as highlighted on this slide. These priorities laid the groundwork for identifying the main topics for this SHIP. Now, I'm going to transition the presentation to my colleagues Lori Call and Janice Goff from IPHI, who will dig into the findings related to the new priority areas below.
Thanks, thanks, Samantha. Building from the interim SHIP update and the data from the state health assessment that Samantha just described, the partnership worked to refine the priority areas for Healthy Illinois 2028. The partnership identified these items as the 5 priorities for the public health system to focus on for the next 5 years. Those include racism as a public health crisis, chronic disease, COVID-19 and other emerging diseases, maternal and infant health, and mental health and substance use disorder. Several items came up as cross-cutting issues or priority areas that cut across all of these areas. The cross-cutting priorities include access to healthcare and wraparound services, the physical and built environment, public health system infrastructure, racial equity, and social and structural determinants of health, such as housing, education, access to food, and transportation. The State Health Assessment document provides a detailed explanation of all of the priorities based on specific data points from the assessments that Samantha described. Let's dig into each of these priorities. The first new priority is to declare racism as a public health crisis in Illinois. 8 entities in the state have already issued a formal declaration, and 6 states have done so as well. As we've seen, health disparities by race and ethnicity persist across health outcomes, income levels, and geographic spread. So racial equity is highlighted in this SHAW and SHIP as both a cross-cutting issue to weave into all priorities in the SHIP, as well as a standalone priority. Black and African American people in Illinois continue to have the lowest life expectancy at birth and experience higher mortality rates from heart disease, cancers, diabetes, and COVID-19. Communities of color are also more likely to experience disproportionate impacts of environmental hazards, such as living near high-polluting industries, lower access to green spaces and parks, higher urban heat island effect because of lower tree counts in their neighborhoods, living near polluted waterways, and are more likely to live in neighborhoods that still have lead service lines. This phenomenon is called environmental racism, and this priority addresses that as well. People of color are also more likely to experience discrimination by healthcare providers, so increasing representation and cultural and linguistic competence in the public health workforce is vital. Our second priority is chronic disease. This is a priority that carried over from the Healthy Illinois 2021 SHIP. It's defined as conditions lasting 1 year or more that require ongoing medical attention, limit daily activities, or both. More than half of Illinois residents live with a chronic condition. Heart disease and diabetes are the leading cause of death in the state, and nearly 1/3 of Illinoisans have high blood pressure and high cholesterol. And there are very clear ways we can reduce these numbers through improving access to resources for prevention and chronic disease management. Access to care for preventative and disease management was one of the primary concerns. Oral health also emerged as a prominent issue in the state for similar reasons. The third priority is COVID-19 and emerging diseases. This is a new priority for many reasons, but particularly as a catalyst for change in the public health system itself. COVID-19 was the leading cause of death in 2020, with extreme disparities across racial and ethnic groups. Many of the important takeaways from the pandemic highlighted work that needs to be done in the public health system to be able to respond better to future threats. We know that as climate change is expected to worsen, this will have many health consequences, including exacerbating and increasing the prevalence of chronic conditions, cardiorespiratory illness, and vector-borne diseases. COVID also highlighted many public health system failings, including workforce challenges, communication gaps, and lack of public trust and inefficient data systems. I'm now going to turn it over to my colleague, Janice Goff, and she will continue with the priorities.
Thank you so much, Laurie. Our next priority is maternal and infant health. Maternal and infant health is a continued priority from the Healthy Illinois 2021 State Health Improvement Plan, as statewide infant mortality remains higher than the Healthy People 2030 benchmark and has extreme disparities by race and ethnicity. The rate of infant mortality is twice as high for Black and African Americans than the overall rate for the state. The focus of maternal and infant health in this state health improvement plan is on improving access to health care and delivering quality public health services for reproductive and infant health. Access to the full range of reproductive health care services and education, prenatal care, oral health, and maternal mental health were highlighted as key issues in this priority. Racism and discrimination are also key issues in this priority because of the stark disparities in health outcomes related to maternal and infant health. The next priority is mental health and substance use disorder. Mental health is a priority that carries from the last state health improvement plan as well, and is defined here as a state of mental well-being that enables people to cope with the stresses of life, to realize their abilities, to learn well and work well, and to contribute to their communities. We know that the pandemic worsened mental health across the board, but it is particularly important for youth, LGBTQIA+ populations, and communities of color as priority populations. Among the pressing issues in mental health, access to care, stigma, and discrimination from healthcare providers were highlighted as barriers to health. Substance use disorder, or the recurrent use of alcohol or drugs, which causes significant impairment to daily living, is another emerging priority area alongside mental health. Mortality rates from drug overdose and opioid overdose have increased across the state, with the highest rates seen in 2020. The emerging needs for addressing mental health and substance use disorder that came out in the state health assessment were expanding youth mental health supports, strengthening the mental health and substance use disorder workforce, and expanding and improving culturally inclusive practice for healthcare providers. As Laurie mentioned earlier in the presentation, in addition to the 5 priorities, the state health assessment revealed cross-cutting issues. The cross-cutting issues fall into 2 categories: structural themes related to the broader society, and the themes that fall into public health infrastructure, which you will see on the next slide. The structural themes that emerged are access to health care and wraparound services, the physical and built environment, social and structural determinants of health, and structural racism and health equity. These are factors that determine health outcomes across the 5 priority areas, and as such, each priority addresses these items in the State Health Improvement Plan. Access to healthcare and wraparound services has profound impacts across the state. It is particularly crucial in rural areas and for trans health and LGBTQIA+ populations. It includes both geographic and physical access to care providers, as well as reducing cost barriers, reducing stigma, and increasing access to culturally and linguistically representative providers across the state. The physical and built environment encompasses everything about where we live day to day. Social and structural determinants like housing, transportation, socioeconomic status, environment, education, and community safety are all important and intersecting issues when it comes to addressing health and health equity. As mentioned before, racism is both a cross-cutting issue and a standalone priority because it is at the root of many, if not all, health issues and disparities. Public health system infrastructure is the second theme, and it can be sorted into 4 main categories: workforce, data use improvements, system coordination and collaboration, and funding. Workforce development and capacity, particularly since the pandemic, system-wide staffing shortages and staff burnout in the public health field have been an increasing challenge, and the system has struggled to keep up. Having a public health workforce that is representative of the community was highlighted as a need, particularly for people of color and LGBTQIA+ populations. And adequate compensation for this workforce to maintain staff is essential. Data use improvements include evaluating current data systems for effectiveness and efficiency and modernizing these systems. Other improvements include improving access to data. For example, consolidating electronic health record systems for providers and/or effectively sharing publicly available data resources. There's also a need to shift data collection practices so that we're collecting accurate and specific data, particularly for racial, ethnic categories and sexual orientation and gender identity categories. Funding for these improvements is also important. Both funding and communications across the public health system need to be de-siloed, meaning that public health entities need to be able to communicate and coordinate messaging, programs, and work streams so that they are not redundant and can address public health needs in a coordinated response. Finally, funding needs to be sustainable and flexible to adapt to the shifting needs of the public health system. This concludes the summary of the State Health Assessment findings, and now we will move into the State Health Improvement Plan, which shows how the state of Illinois public health system plans to address the needs of these priority areas. I will turn things over to Jenny Epstein.
Thanks, Janice. I will present the next several slides on the State Health Improvement Plan. As we said earlier, these are the 5 priorities, and listed here are the cross-cutting issues that are woven into the goals, objectives, and recommended strategies of each of these priorities. The planning team worked with a team of subject matter experts in each of the 5 priority areas to develop goals, objectives, and recommended strategies that are listed in the State Health Improvement Plan through a series of workshops over the first half of 2023. These plans are aligned with existing work in their respective fields and with other plans across the state. Starting with racism as a public health crisis, I will go over the goals that were developed in this priority and then review the objectives and a sample of the recommended strategies that were developed to address this priority. 3 goals were established for this priority and focus on 1, capacity building for the public health system to do this work, including how to dismantle oppressive systems. 2, developing and maintaining a diverse and skilled workforce for anti-racist public health. And 3, addressing the practices that perpetuate environmental racism. Each of these 3 broad overarching goals have objectives that further define and focus our proposed work. We will review the objectives for each goal next. The first objective is to formally declare racism as a public health crisis in Illinois, like many other cities, states, and jurisdictions have. This will elevate racial equity as a priority for our state with an advisory committee and a plan to operationalize it. The other objectives are focused on infrastructure, ensuring there are resources to do the work, capacity building for the public health system to authentically engage and power share with the community, and finally, to build the state's data capacity to better understand and address needs. With these objectives in Goal 2, we want to ensure the public health workforce and leadership across the state is representative of the diversity of our state, and that we have policies and infrastructure to support this work. Goal 3 is focused on advancing environmental justice. We want to reduce and prevent environmental hazards, build our state's capacity to map, track, and assess environmental inequities and a plan for addressing them, and increase investment in both the natural and built environment, specifically in Black, Indigenous communities and communities of color. Subject matter experts from across the state work to make recommendations on strategies that will help advance these goals and objectives. Each objective has a full set of recommended strategies. All of the recommended strategies are listed in the appendix of the State Health Improvement Plan report. For racism as a public health crisis, there are over 60 strategies. Here are just a few examples. Strategies range from state-level policy to small p policy and using a health in all policies approach to ensure our policies don't have unintended negative consequences. We also have strategies focused on building the public health infrastructure through training and pipeline programs to increase the BIPOC workforce. And we have strategies to address climate change impacts and to conduct health impact assessments and cumulative impact assessments related to permits impacting air, water, and land pollution in environmental justice communities. Next up, we will talk about chronic disease. 4 goals were developed for addressing chronic disease. These were decreasing tobacco usage, prevention of disease through nutrition, prevention through active living, and building community capacity for disease management. Each of these goals has objectives and strategies to support their purpose, which we will go through next. In Goal 1, we hope to increase tobacco-free living by reducing the number of people using all types of tobacco products, enhancing public health infrastructure to prevent tobacco usage, and reducing secondhand smoke in cars, housing, and other places where people are regularly. Goal 2 focuses on access to nutritious foods. With this goal, we want to encourage businesses to implement healthy food policies, strengthen nutrition assistance programs like SNAP and WIC, and increase nutrition education and awareness, and make sure messaging is culturally competent and realistic for people to achieve in their current lifestyle and location. Goal 3 focuses on active living. We want to address active living in schools and workplaces through policy and program changes. We want to improve the built environment to create more safe and accessible spaces in priority communities, and we want the public health system to work across all sectors to promote active living. Finally, Goal 4 focuses on strengthening communities' ability to prevent and manage chronic diseases at the local level. This includes having more community health workers, improving data systems and practices, more programs for prevention and disease management geared towards specific populations, reducing cost barriers, and expanding screening and assessment processes to have better strategies to prevent and manage chronic disease. Again, subject matter experts from across the state work to develop a list of recommended strategies for each objective to support the 4 broad goals. The list for chronic disease included over 100 strategies, which cover many topics from targeting system barriers and accessing services to support tobacco-free living, to cross-sectoral partnerships with state partners like the Illinois Environmental Protection Agency and the Illinois Department of Transportation to apply a health in all policies approach to built environment and development decisions. Some strategies also focus on the public health system itself and developing a public oversight body to oversee the spending of the Wellness Fund resources, developing policies and programs to eliminate racial disparities, and to improve data collection for underrepresented communities to better understand the health status and needs of these populations. Next, we will move to COVID-19 and emerging diseases. There are 3 goals for this new priority. Goal 1, decreasing health disparities related to COVID and other emerging diseases. 2, strengthening community resilience to emerging health threats. And 3, improving public health infrastructure to respond to and prepare for these new threats. The first goal focuses on health disparities. We want to improve equitable access to vaccination, testing, and treatment, improve public trust in the public health system, increase vaccination and testing in under-resourced communities, and improve dissemination of vaccines in congregate settings and with homebound individuals. Goal 2 focuses on community resilience by building trust between communities and their health departments, improving access to resources related to the relevant emerging disease for priority communities, and improving both indoor and outdoor environmental conditions to reduce transmission and vulnerability. This final goal focuses on the lessons learned from the COVID-19 pandemic in improving public health infrastructure to prepare for and respond to emerging threats. This includes having a timely and partner field-informed communications plan, coordinating emergency preparedness and response activities across the public health system at all levels, improving data sharing systems, and improving the public health system's resource capabilities to be more efficient and effective. The strategies developed for these 3 goals mainly reflect the lessons learned from the COVID-19 pandemic and Mpox outbreaks. So the subject matter experts that convened on this priority focused mainly on infrastructure improvements. Some examples include developing data dashboards and detailing emergency worker responsibilities for IDPH staff to improve responsiveness. Improving public trust in the public health system is also a priority. So working with community leaders to disseminate information and engage in awareness trainings, as well as establishing an equity team to improve outreach to priority populations, are some of the recommendations. Next, we will move to maternal and infant health. There are 4 goals for the maternal and infant health priority. Improving access to and quality of equitable reproductive health services. 2, improving systems of care and support services for all birthing persons. 3, improving systems of care for better birth outcomes and infants' healthy development. And 4, addressing mental health and substance use disorders among pregnant and postpartum individuals. The first goal focuses on reproductive health care by increasing availability and quality of preventative medical visits with sexual and reproductive health screenings and increasing access to the full range of reproductive health services. Goal 2 focuses on support for birthing persons through improving access to and quality of prenatal and postpartum care and services, improving maternal morbidity and mortality outcomes in hospital settings, and addressing social and structural determinants and barriers to care for pregnant and postpartum persons. Goal 3 focuses on infant health outcomes by improving access to and quality of and coordination of services across the perinatal continuum and addressing social and structural determinants of health for infants. And the fourth goal here focuses on mental health for pregnant and postpartum individuals. We want to address substance use disorder to reduce the rate of neonatal abstinence syndrome and pregnancy-related mortality. And we want to reduce postpartum depression and pregnancy-related mortality from mental health. These strategy recommendations have an emphasis on equity, particularly in addressing maternal and infant mortality disparities across racial and ethnic groups, and access across the full continuum of healthcare services. Some examples of recommendations include developing in-school clinics in high-risk areas, increasing availability and quality of mental health and substance use disorder services for pregnant and postpartum individuals, as well as piloting an income supplementation program. Other strategies highlight the work of the Illinois Task Force on Infant and Maternal Mortality among African Americans to decrease health disparities in this population. For the final priority, we will move into mental health and substance use disorder. This priority has 4 goals that focus on improving community capacity for mental health and substance use disorder support, as well as public health system infrastructure. These goals include improving the public health system's ability to prevent and treat mental health and substance use disorder. 2, developing and implementing harm reduction and preventative care strategies. 3, reducing institutionalization and incarceration by strengthening community-based care. And 4, improving community resiliency and recovery capital in response to violence. The first goal focuses on infrastructure by improving data capacity, increasing the system's ability to address behavioral health more effectively, integrating mental health and substance use disorder care with other healthcare services, and increasing funding for these improvements. Goal 2 is intended to reduce mental health and substance use disorder mortality through harm reduction and preventative care. In alignment with the State Overdose Action Plan, we want to improve age-adjusted suicide rates, improve mental health in children, adolescents, and young adults, and improve morbidity and mortality of substance use. We also want to improve prevention and linkage to care. This Goal 3 aims to reduce mental health and substance use disorder related to institutionalization and incarceration. We want to narrow the treatment gap through community-based treatment and increase access to services, particularly for communities with disproportionate rates of incarceration and populations that have lower access to mental health services. And the last goal focuses on community violence. To advance this goal, we want to increase mental health and substance use disorder services in communities with high rates of violence and prevent and address adverse childhood experiences, or ACEs. To do these things, we also want to improve data collection related to community violence and develop tools and resources to better respond and prevent community violence. The subject matter experts recommended over 80 strategies. Many of the recommendations focus on harm reduction and prevention strategies and community-based support. These strategies cover a wide range of areas, including improving data infrastructure, strengthening public health workforce capacity, and developing crisis response teams. Some prevention and harm reduction tactics include incentives, trainings, and policies to improve providers' ability to treat substance use disorder as a part of regular medical care, as well as increasing screening for substance use disorder and access to medication-assisted recovery for those who are or have been in the criminal legal system. This includes the State Health Improvement Plan summary. We will now move into public comment.
Thank you, Jenny, and thank you, everyone. So we are now in the public comment period of our SHIP public hearings. We have some instructions here for you to review. Speakers who pre-registered have 3 minutes each to provide their public comment. Please be mindful of time so we can hear from as many people as possible. We have allotted 90 minutes for speakers in total. When it is your turn to speak, I will call your name and unmute your mic to share your comment. Only the current speaker will be unmuted. At the left-hand side of the slide here, you'll see this pop up when I unmute you. Make sure to click unmute and then you'll be able to speak. Make sure to also use the chat. Have that open, as Adrian will be using the chat to let you know when you're next in line to speak and to give speakers a 1-minute warning. As a reminder, members of the press in attendance today are not permitted to speak. And finally, if you would like to provide a written comment, we will drop the link in the chat. You'll see it on the screen here as well to do that if you prefer to provide a written comment. So I will start by naming the folks who have pre-registered. There might be some folks here who pre-registered, but they're not on the line. I'll name them regardless. And then we will, if they're not there, I will move on to the next person. Ebony Zielinski, and I don't see Ebony on the line. If you are on the line, feel free to drop in the chat and we'll get back to you. The next person we have is Elizabeth Olendide. I don't believe that Elizabeth is on the line. And the third person we have on the line is Andrea Cross. Andrea, I will unmute you now.
Hi, good afternoon. Can you guys hear me? Okay. One question. I think the initial, all of the efforts in the initiative are fantastic and very encouraging. But one of the things I'd like to just know a little bit more of how, you plan to target the issues with distrust with the medical system and medical providers for, the population in Illinois, because that's what we really saw. I'm located in Chicago proper. I'm the Stroger Perinatal Network Administrator. And in working in public health, we really saw a big issue with getting trust from the community to get vaccinated, and even to the point where they were not really willing to listen to conversations about the protection that you would receive from the vaccination and how important it is for the community. We saw so many people just not trusting the medical providers. And so that's a tremendous obstacle, not only for non-pregnant patients, but for the pregnant patients as well. So I'd like to, really know more about that.
Thank you, Andrea. This is a public comment period only, so we're not allowed to respond. But I will say that those exactly how that will be done will be planned in more detail beginning in January with implementation planning. And you can also take a look at the state health improvement plan for all the strategies that will be deployed. And we're very interested in your ideas for how to address that as well. So please, we welcome your public comment written in writing. You can submit comments by that link. So if you have some thoughts on how to do that, we'd love to hear them.
Great, I surely will. Thank you.
Thank you for your comment. And our next person on the line, or the next person called is Katie Harrison. I don't see Katie on the line. The next person is Shirley Davis. And I do not see Shirley on the line. The next person is Mary Hines. We do not see on the line either. And following Shirley is Chelsea Barnes. I will go ahead and mute you, Chelsea.
Hi, everyone. Can you hear me okay?
Yes.
Hi, Chelsea Laliberte Barnes. I'm a social worker. I'm also the co-founder of the Illinois Harm Reduction and Recovery Coalition. So I am thrilled that the mental health and substance use disorder section of this has been so well thought out and well developed. One of the things that we're seeing in communities of color and really communities all across the state is just the vast amount of overdose deaths and overdoses in general, statewide, rural, urban, suburban, you name it. And there are many communities out there that are not currently implementing harm reduction strategies to reduce deaths and to reduce issues like infectious diseases, et cetera. One of the things that I did not see in the action plan that I really wanted to advocate for are overdose prevention sites, also known as safe injection facilities. And these are evidence-based strategies that are all over the world. They are recognized and really fully vetted by the public health community across the world. There are more than 200 sites globally, including here in the States, in New York City and San Francisco. There will soon be one in Rhode Island, and then in Canada. And what we are seeing is that these types of facilities provide wraparound care and support for people who are using drugs to help them become better educated on safer drug use, but also a place to use drugs safely, especially with the contaminations of fentanyl and xylazine and other things that are so dangerous right now on the street, to be able to reverse the overdose if it occurs for somebody using in the facility and there has never been a death. And so I would just like to really advocate for the addition of overdose prevention sites as a strategy for the plan over the next 5 years. We really don't have time to lose. And we've seen how much these types of interventions save money. They reduce costs from emergency services. They provide a direct link for people to access healthcare services, job training, food, and a lot of the other strategies that you mentioned. And they really do, they are strategies that are cross-cutting across the board. And I think the final thing that I just want to say is I think with harm reduction, we can't pick and choose the strategies that we are using. We have to use everything we can and throw everything we can at this crisis of substance use disorder and overdose. So I just want to encourage us to really be thoughtful and broad and take a look at what's working in other communities. New York City just presented a report that I think Brown University did on, do these facilities also reduce crime? And yes, they do. They do reduce crime. They don't increase crime. They do a lot of other things that are environmentally sound. So I think we just have to pay I just want to encourage the state to pay close attention to this specific strategy and don't overlook it And yeah, thank you so much for giving me the opportunity to speak on this topic.
Thank you for your comment. The next person on the line or the next person is Beth Corsetti. Doesn't look like Beth is on the line. So the next person to speak is Amy Potter.
Hello, my name is Amy Potter and I'm a clinical social worker at Jesse Brown VA. We've just started some harm reduction work in the VA system. I've been in the field over 20 years. I've seen the great work that a lot of the community providers do that, you know, kind of have led this initiative. I'm really pleased that Illinois is kind of stepping up and making these recommendations. Reducing mortality due to mental health conditions and SUD through harm reduction is really important. We've seen the impacts on veterans with kind of both mental health and substance use challenges. I think, you know, we really need to be building on overdose prevention centers. Like Chelsea was saying, as this evidence-based harm reduction intervention that's not been available in the US, but that are supervised consumption centers, safe places where people can consume pre-obtained substances in monitored settings, which supports all of the things that you all have spoken about today. Making sure that people are safe, surrounded by services, surrounded by treatment, and supported and shown love, kindness, and interventions that have been proven to be effective in the treatment of substance use, addiction, and mental health. So I just like to encourage this panel and anyone who has the position and power to be able to make some positive changes in this city and in this state where we've seen, you know, huge amounts of overdose and death for really not great reasons. Had we had some of these things in place, we could have really prevented people dying from this. So thank you.
Thank you for your comment. The next person on our list is Tashana Gillenwater.
Hi, good afternoon, you all. My name is Dr. Tashana Gillenwater, and I am actually a licensed educator in the state of Illinois, physical education, health education, with a doctorate in education. And I really appreciated the webinar today. It was very interesting. I've actually done work before with Illinois Public Health Institute when I was actually a PE teacher. My comment is just basically, you know, the issues that we have now with food deserts and the lack of education that the communities of Black and African American people do not have, the lack of education. I've always stated that students grow up to be adults, and at the end of the day, what they didn't get in school, they tend to not get when they become adults as well within those communities. So I'm just hoping that this is just the first step of Illinois, you know, actually taking a chance on actually, you know, trying to heal our state because it's in great turmoil right now. But I'm hoping that these great institutions work more with the educators because we are in the trenches as well. There are educators like me that actually are outside of the school systems that are really want to work with organizations to educate these communities, because a healthy and whole person is an educated and whole person. So that's just my comment. And I hopefully look forward to working with some of you all.
Thank you for your comment. The next person that we have is Sandy Martell, and it doesn't look like Sandy is here. So after Sandy, we have Christine Schmitz.
Okay, I don't know if you can you hear me? Perfect. Okay. So I'm going to be talking to you about basically Lyme testing. And my situation might sound really extreme, but in April of 2021, I was very gung-ho on getting the vaccine as soon as I possibly could. And I did. And after that, I started developing severe digestive problems. And I started going down a long string of visiting doctor after doctor because my problems just kept getting worse. I ended up having several MRIs, went to the emergency room several times. I developed something called postural orthostatic tachycardia syndrome, POTS, and extremely low blood pressure. My situation became more and more dire, and I eventually, so when I got the diagnosis of POTS, I got this from a autonomic specialist who has a 2-year waiting list, and this is out of the North Shore system. And I got this visit because I went to the ER enough times that the ER doctor got me in touch with him. And I am someone who is basically privileged, and because of this, this is how I got to see this neurologist. This neurologist put me on 2 heart meds. One is ivabridine or Carlanor. This is a very expensive pediatric heart drug to get my heart rate down, and fludrocortisone, which is a steroid to get my blood pressure up. He also put me on 2 antidepressants, Wellbutrin to get me out of bed in the morning, and mirtazapine to get me to eat again because I had lost 40 pounds. I also was put on 2 benzodiazepines, clonazepam to help me calm down during the day, and Valium or Xanax to help me sleep at night. As you can imagine, this is quite a cocktail of drugs. I was fully functional and pretty normal. And my health declined so quickly over the span of, this 10, 11 month period. I became suicidal, and I ended up finding my own doctors. I went to a Lyme literate doctor downtown, and honestly, she was mediocre at best. I had so many lab tests done. I spent thousands and thousands of dollars. And again, it's because I am privileged that I'm able to do this. And my husband said, we will not stop until we find an answer for you. And lo and behold, we found something called Bartonella, which is a co-infection of Lyme disease. That was just the beginning. And I had to fight to get an appointment with this Lyme doctor to get a follow-up. Antibiotics did help me in the beginning, but my genetics are such that I can't even handle antibiotics. But the testing that was done, had it been done a whole lot earlier, I didn't have to be on 2 heart meds, 2 antidepressants, 2 benzodiazepines. These made me so much sicker. And let me tell you, the MRIs that I had done filled me full of toxic gadolinium, and I got gadolinium poisoning, all for them to say, oh, nothing's wrong with you, because they don't run the right tests. And these tests are not that expensive to run. And I sound really angry because I'm basically undoing 50 years of bad medical care. I have anxiety and depression written all over my charts. I am not on one anti-anxiety or antidepressant right now. I am not on any pharmaceutical meds right now. And I'm healing myself by using energy, which is a whole other set that people don't believe in. But I'm just here to talk about getting accurate testing for Lyme disease. It is a real problem. And bacteria, parasites, viruses, we have better testing options, and they're not being used. And doctors love to tell women, especially, that they are anxiety ridden. I had a nurse practitioner from this top neurologist tell me that I was faking my Parkinson's symptoms. I was in there, couldn't move my face, and she had the gall to tell me, I wrote down my little list of symptoms. And I Googled my list, and that's where I got my list of Parkinson's symptoms. I said, "You think I have Parkinson's?" And she said, "No, I
Thank
think
you,
you Googled
Christine.
it."
I'm sorry to cut you off, but we are at time. My apologies. If you would like to provide more of a written comment, we have links in the chat to add more information. Thank you. Okay. The next person on our list is Creola Hampton. Creola, feel free to unmute. If you're having any technical difficulties, feel free to comment in the chat and we will come back to you. Until then, the next person on our list is Cecilia Hayes. Cecilia, feel free to unmute.
Hi, I'm Cecilia Hayes. Thank you for having me. I'm here as I am a Class X felon. I worked in the medical field, so in order to work in the medical field, you have to take classes. And I also had my first child at the age of 20. I'm 40 now. So I have kept up with our doctor's appointments and everything. So going to these doctors and working in the medical field, okay, when you work in the medical field, you see a lot, you deal with a lot of people, and you come across people that you tries to help. So in the medical field, when you're taking classes, you have your instructor. Your instructor was one of the head people that's worked in these hospitals. So these people are the people who sometimes they adopt some of these kids. So when they're adopting these kids, they seeing what's going on with these parents in our community, the Black community. So they be biased. They be biased as far as me speaking with them, just listening and hearing them out. Oh, she's sitting up here drinking and doing this, taking care of their kids. The state, they're dependent on the state. They always will throw this in your face. People is not shy to tell you how they really feel about you, as far as in the racial area. And a lot of people don't speak up, and we bag down because we know if we do speak up, you're either going to lose your job, you're going to lose these people, because now you're telling on them and they don't like that. So you're not going to get the care that you expected. They're going to continue. For years, I've been going through things with me and my daughter. My daughter been having an issue. She will be 17. This is a bright girl in school and all, and at home. She do good. She work, great grades, all of that. They will run the same test. My thing is, I believe if they can go about by providing care and not being biased, a lot of this racial and the anger will go away. People don't like when you call them out on their bull crap, but it's not what you do, it's how you do it. If I feel a certain type of way, I speak my mind, I voice my opinion, but I don't have to be ignorant with you to get my point across. And I feel that a lot of women think that Black women are angry and mad. A lot of us are angry and mad. We are, because we do want opportunities. We don't want handouts and subsidies. We don't. We want to be able to work to earn our money. We don't want to be on public aid. I know for a fact I don't. I worked in the medical field. I got hurt in the medical field because of my boss. And I'm penalized for that. Like, my life is a wreck because of it, but I'm not going to give up. And the reason I'm not going to give up, because I believe in myself. Someone else believed in me for me to get that far. So I'm not going to give up, because I messed up. I got hurt. That ruined my career in the medical field. So my point is what I want to say, and what I would love to see happen. If people can have a little patience with us, as far as Black women, you as our doctor, if I'm telling you this is what's going on, don't prescribe me no high blood pressure medicine. If I'm telling you I can't sleep at night, my ears was bleeding from that. Listen to me. I'm telling you what my body is doing. So I need for you to listen to me and to help me. And if you're not helping me and you're doing other, of course that's gonna make me frustrated. But no, the yelling and cursing, no. If you're caring for me, why would I come at you and be ignorant towards you? I'm not, because you're my doctor. So by you being my doctor, I'm telling you things that's going on in my life. You're gonna learn a lot about me. So you will have more open windows to help me because you know my sex life, you know a lot about my children, you know a lot in my areas of life because you're my doctor and I'm telling you what's going on and situations in my life. Don't use that to bash me or down me or put us all in a group because we're not all grouped together. We as women, yes, we're women of color, but a lot of us went through a lot and is going through a lot and we're still trying to hold it together. And the doctors are not making things better because they're not hearing us out. We're coming to them for help.
Cecilia, my apologies. We are at time, but thank you for your comment. And if you'd like to add an additional comment, please do so in our written comment form in the chat. Thank you for your comment. The next person on our list, who I don't believe is here, is DeAndre Love. And following DeAndre is Cerise Depardieu. It doesn't look like they are on the line. So the next person is Angela McLemore. Angela, feel free to unmute.
Hi. Hear me? Yes? Okay, I am Angela McLemore. I work for State Senator Maddie Hunter. I am her executive assistant and I take care of all her healthcare issues and task forces. I am a retired hospital administrator of inner city hospitals as assistant and associate administrator for 14 years. And I worked as the CEO of federally qualified health centers for 16 years. I have a lot of other experiences in healthcare, but I just, for the sake of time, want to say to you that I liked what I have seen. I liked all the goals and objectives that I saw. There are 3 words that I think come together that have been mentioned: recommendations, strategies, and the third happens to be implementation planning. I think in order to make the goals and objectives happen, we have to spend a lot more time on implementation planning. And we need to attach the money, manpower, and materials necessary for each plan that relates to the goals and objectives. The recommendations are fine. I see recommendations as being somewhat of strategies, but I am looking forward to the implementation planning so that all these goals and objectives that have been presented can become, can happen, that they will have an impact on the community. Communities will probably have to respond to different kinds of requests for proposals. I don't know, but I think that is what is going to bring all these goals and objectives together, is actually the implementation planning, making these happen. And that's my comment. Because I think they lack we need to be involved in the implementation planning to make these goals and objectives come to fruition.
Thank you for your comment, Angela.
Yeah.
The next person on our list, it's Betsua Rubio. Feel free to unmute.
Hello, my last name is Rubio. My first name is Betsua. I am a public health nurse with Chicago Public Schools. I have worked for 3 different public sectors in the community in the education before the pandemic since 2019. And I am here today humbly asking, just as Angela stated, we have been in the forefront of the COVID pandemic. We have provided the resources to our communities. And it has been very overwhelming. We are looking into a lot of children starting to do a lot of drugs in our schools, and mental health services has skyrocketed after the COVID pandemic. We have seen families passing away. Chronic diseases, we are seeing the lack of implementation from medical providers to adequately provide medical orders. This includes asthma action plans, allergy action plans. We need everything based on the medical providers have to be provided to us as school nurses. I am humbly asking IDPH to please provide us with more resources in the public sector. This includes our school nurses in Chicago Public Schools. It's just been overwhelmingly these past few years. And although there has been rearrangements of strategies, there are very little of us certified school nurses that we need more help from the Department of Public Health. We need more resources. It is a very, we are in a human crisis. We're getting more immigrants. We need catch-up vaccines. And unfortunately, these children would not be fully immunized immediately. There are scheduled vaccines. We need a lot of education. I'm a bilingual school nurse, and I am nonstop for the hours that I am here. So I am humbly asking, please help us.
Thank you for your comment. And the next person on our list is Lorenzo Weber. Lorenzo, feel free to unmute.
To find the mute or unmute button, it should be on the left-hand corner of the bottom of your Zoom screen.
I think there was no comment in the chat there, so.
Okay.
Thank you, Lorenzo. Okay, and I believe the final person who was on the list who wasn't able to speak. Oh, I think that's everyone. At this time, if you have not already spoken but would like to provide a public comment, please message us in the chat to say that, yes, I would like to provide a public comment, an oral comment. Otherwise, feel free to use the written comment portion. We have links to the written comment form, reports for the Healthy Illinois 2028, and registration site link for tomorrow's session that we will drop in the chat for you now. Please note that all three presentations that over these 3 days are the same, and all sessions are from 1 p.m. to 4 p.m. We will stay on the line until 4 p.m. to allow for public comment. So as I said, at this time, if you would like to provide a public comment and you were not registered to do so, please message us in the chat to let us know, and we will unmute you for 3 minutes. Thank you.
We do have a couple of written comments in the chat that we can see, but participants can't, so I'll share those. One is from Samantha Widener. I work for the Clay and Effingham County Health Departments as the Early Childhood and Special Projects Director. I run programs and serve many roles, but one of my favorites is being involved in local coalitions and developing our I-plans. Thank you for your work on the SHOT SHIP. Our 2023 I-plan for Effingham County strategies are access to care, which includes oral health and transportation, cancer, and behavioral health. Our 2023 I-plan for Clay County strategies are access to care, oral health and transportation, and then obesity and heart disease and behavioral health. In rural Illinois, we are seeing large disparities in those struggling for transportation, which is resulting in delayed treatment. COVID has created new avenues for our community members to receive services, but we strongly need additional support around education on how to get Services Creativity in Rural America. And there was also a comment from Creola Hampton. Creola, did you want to make a public comment now?
I believe so, so I will unmute. Creola, I've unmuted you. Feel free to use your 3 minutes.
Good afternoon. Just wanted to check and make sure I'm being heard. I see the nod, so that means yes. I am participating today in multiple capacities, of course, first as a citizen and a resident of the state of Illinois, as an African-American woman, and as a leader of an organization that serves African-American led organizations, and also as the co-founder and chair of BLACHE, BLACHE, which is the Black Leadership Advocacy Coalition for Healthcare Equity. And it is comprised of 19 organizations from across the entire state, Chicago to as far downstate as East St. Louis, suburbs, West Side included, that are primarily those who are providers of HIV and AIDS services to the African-American community. Our primary issue and challenge, as you first stated, the first point, that pillar you have, is that racism is a public health issue. The unfortunate dilemma is the Illinois Department of Public Health funding is so highly racially inequitable that it perpetuates racism being a public health issue. We're at a point where African Americans are 14% of the population, as you well know, but for the last 3 decades have been 48% plus of HIV and AIDS new diagnoses and 52% of existing cases of HIV and AIDS. Yet the Illinois Department of Public Health HIV AIDS budget allocates less than 2% of its funding to African American led organizations that have the enhanced cultural competency, that are located in African American communities and have the maximal degree of effectiveness, 2%. Currently, the budget for HIV and AIDS under the Illinois Department of Public Health is $120 million, and only $1.7 million of that goes to all the African American led organizations combined across the entire state. You have slides and information from your own HIV Director Andrea Perez that has been presented at our HIPC meetings, and it is unconscionable for the rates of AIDS to be as high as they are in the African American community, yet the funding is not following and being allocated to those organizations that do the work. And even worse, when the funding is allocated to them, there is $15 million that was allocated to them in May 2021, and less than $3 million of that funding has been issued to those organizations, to the point that they are in jeopardy of losing that funding because IDPH is saying you do not have enough staff and grant managers to do the necessary management of those funds so that it can get to those Black-led organizations. It ought to be criminal. It's also almost like grounds for a class action lawsuit against the state. The state is going to be leading, saying that racism is a public health issue. Then the state has to be actively involved in making sure that there is equitable funding going to African-American led organizations to do the work that needs to be done to negate the inequity of health.
Thank you, Creole, for your comment. The next person on our list is, Alberta Walker. Alberta, feel free to unmute. If you're having any technical, oh, there you go. Alberta, I see you're not on mute, but we can't hear you. Okay. Alberta, if you're having technical difficulties, please comment in the chat and we can come back to you. Okay, thank you. The next person on our list is Dominique Mosley. Dominique, feel free to unmute. Dominique, if you're having any technical difficulties, the unmute button is at the bottom left. Dominique, feel free to let us know in the chat if you're having any technical issues that we can support you with, or if you'd like to provide a written comment, feel free to do that. Okay, as we previously noted, for those of you who either just joined us or have not yet spoken up, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you'd like to provide a written comment, please see the chat for the link. We also have links to the reports as well as the link to register for tomorrow's session if you missed today's presentation. Please note that all 3 public hearing presentations are the same. Tomorrow's session will also be from 1 to 4 as well as today's. We will stay on the line today until 4 p.m. to allow for public comment.
Thank you, Samantha. Dr. Arnold, did you want to make a comment before I close out this small group?
I was just typing a note to you saying that it's not completely necessary, but I just wanted to commend the group on the work that they have accomplished. A lot of work went into this, and I like the direction that you're moving in, and just wanted to say that. And just hopefully we'll get more people in the workforce for public health. I always have to make a comment about that. But thank you, Karen. Thank you.
Thank you, Dr. Arnold. Thank you, everyone, for your feedback today. I'll close out this small group if you would like to know the next steps in the process. We will be reviewing everything we heard today, as well as all the information for the other hearings, to take it into consideration as we finalize the SHIP. We appreciate you all joining us today to share your voice in the matter of health improvement in Illinois. For anyone who has not had an opportunity to speak, you can provide written comment via the Google form link in the chat. We encourage you to do that to enhance your comments or to add additional. Comments must be submitted by 5 p.m. on Thursday tomorrow. We will have another hearing tomorrow at the same time from 1 to 4. The SHIP document will be finalized and presented to the General Assembly per the law. Comments from these hearings will also be shared with the action teams as they launch in January to develop and implement detailed implementation plans. Thank you all once again for your interest in the State Health Improvement Plan, and a special thank you to the staff at IDPH and IPHI who presented here today. We will be here until 4 p.m. for anyone who would like to make an additional comment. We thank you all for being with us.
For those of you who have just joined us, if you would like to provide a public comment, we are in the public comment period of the public hearings for the State Health Assessment and State Health Improvement Plan. If you would like to provide a public comment, please drop it in the chat and let us know if you would like to, and we will unmute you for 3 minutes. If you would like to provide a written comment, see the link in the chat below. We also have a link to the reports as well as a link to register for tomorrow's session. If you missed the presentation today, please note that all 3 public hearing presentations are the same. Tomorrow's session will be from 1 to 4 p.m. and we will stay on the line until 4 p.m. today to allow for public comment. For those of you who may have just joined us, we are in the public comment portion of the public hearings for the state health assessment and state health improvement plans, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session if you missed today's presentation. Please note that all 3 public hearing presentations are the same. All sessions are from 1 p.m. to 4 p.m., including tomorrow's. And we will stay on until 4 p.m. today to allow for public comment. Thank you. For those of you who have just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2026. If you would like to provide a public comment, please feel free to message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the link in the chat below. We also have a link to the reports as well as a link to tomorrow's session if you missed today's presentation. Please note that all 3 public hearing presentations are the same. All sessions are from 1 p.m. to 4 p.m., including tomorrow's, and we will stay on the line today until 4 p.m. to allow for public comment. Thank you. For those of you who may have just joined us, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as the Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat. We will unmute you for 3 minutes. If you would like to provide a written comment, see the link in the chat below. We also have a link to the reports as well as a link to tomorrow's session to register if you missed today's presentation. Please note that all 3 public hearing presentations are the same. Tomorrow's session will also be from 1 p.m. to 4 p.m. and we will stay on the line today until 4 p.m. to allow for public comment. Thank you. For those of you who may have just joined us, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, please see the links in the chat. We also have links to the report as well as to register for tomorrow's session if you missed today's presentation. Please note all 3 public hearing presentations are the same. Tomorrow's session will also be from 1 p.m. to 4 p.m. We'll stay on the line today until 4 p.m. to allow for public comment. Thank you. In our last 5 minutes for public comment, we are here for the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for the next 3 minutes. If you'd like to provide a written comment, see the chat for the link. We also have links to the report as well as to the registration for tomorrow's session if you missed the presentation today. Please note that all 3 public hearings are the same. Tomorrow's session will also be from 1 p.m. to 4 p.m. and we will stay on until 4 p.m. today to allow for public comment. Thank you.
Thank you, everyone. I will quickly go through the next steps in the process. We will be reviewing everything we heard from you all today, as well as the other hearings, to take into consideration as we finalize the SHIP. We appreciate you all joining us today and sharing your voice on the matter of health improvement in Illinois. For those who weren't able to speak, you saw it was in the chat. You can hook up to that link or comment via the Google form link in that chat. Comments must be submitted by 5 p.m. on Thursday, November 30th. That is tomorrow. We will return tomorrow at 1 p.m. The SHIP document will be finalized and presented to the General Assembly per the law. Comments from these hearings will also be shared with the action teams as they launch in January 2024 to develop and implement detailed implementation plans. Thanks to all of you once again for being with us and for your interest in the State Health Improvement Plan. And a special thank you to the staff at IDPH and IPHI who presented here today. This concludes today's public hearing, and we will be reconvening tomorrow at 1 p.m. Thank you.
Thank you.
Thanks, Karen.
Bye now.
Bye.
Bye-bye.